So what causes halitosis? Well, our experience has been that there are always multiple causes in every patient we've ever seen. And I suspect every patient we will see in the future will also have multiple causes. The biggest overriding issue that we see is that this problem does come from an imbalance in the oral flora. That imbalance can come about for a lot of different reasons, but in essence, there's an excessive amount of gram-negative anaerobic bacteria. These gram-negative anaerobic bacteria need a certain type of environment to thrive in, and normally in the mouth they are there in a low level, but with someone with halitosis, they are there in an excessively high level. Why they're like that varies from person to person, and there are numerous causes for that. What the anaerobic bacteria do is they actually produce what are called volatile sulfur compounds. These are known as VSCs. And the VSCs are the compounds that you smell when you smell somebody with bad breath. So our goal, obviously, is to get those reduced, and the key is to finding out why a person has this imbalance. Common causes of this problem are due to sinus issues, whether it be sinus infections, sinus congestion issues, sinus drainage, such as postnasal drainage. In the case of postnasal drainage, what will happen is you'll get a development of a biofilm from that mucus, and it gets onto the tongue and promotes the growth of these bacteria. Another common cause of this, in fact, it's the most common cause we find of halitosis, is dry mouth. And dry mouth is a difficult problem to deal with. It's so difficult we never tell patients that we're going to solve it. We hope that we'll improve it at best. But there are a number of different products which I'll allude to a little later about halitosis and its relationship to these dry mouth problems. Clearly, there are dental infections that can be either tooth origin or they can be of gum origin. Generally, in our practice, we don't see patients with that because by the time they get to us, those kinds of problems have generally been resolved. The tongue is another issue. There are various anatomical issues that can occur with the tongue that can help promote the growth of these bacteria in the tongue. So the tongue tends to be kind of a focal point of this halitosis.